You are watching Radicon. Welcome to Radicon Institute. As you know, FRCR has various components. Each component has its own secrets and techniques. We will learn how to pass each component separately, confidently, and easily. This presentation covers rapid reporting for upper limb. We will show you how to deal with upper limb films in exam and real life with review of important cases. This is Dr. B, and I will be your study partner in this presentation. The word rapid reporting makes people nervous. Why is that? It is probably because there are so many questions and mysteries around it. Why do people fail? So we can tell you that more people fail because they overcall. They see and do things which do not exist. Many people want to find the most subtle and difficult finding, which is not the purpose of rapid reporting. Another question is, what are the numbers and proportions of normal and abnormal films? There are a total of 30 films with ideal proportion of 15 normal and 15 abnormal. In exam, this proportion can vary. You can see up to 17 or sometimes even 18 abnormal films in some packs, but no more than that. So if you are seeing 19 or 20 abnormals, then you have done a mistake. Can I use abbreviations such as R instead of right and L instead of left, hash as fracture? So answer is yes, you can. But we know that there are certain examiners which do not like it. So why risk it? My advice is please do not use abbreviations. What about normal variants? For the exam purposes, normal variants are considered normal, and so are heel rib fractures, except in children where it can be NAI and you will mark them as abnormal. Another question is, can I get half marks? And what are total passing marks? So maximum marks are 60. To pass, you have to get 54, which means 27 correct diagnoses, each getting 2 marks. But yes, examiner can give you 1 mark instead of full 2 marks. To pass the rapid reporting component of FRCR exam, you must understand the basic concept. Rapid reporting is not your test to find any subtle, early, or suspicious finding. It is designed to test your ability to call something normal. This is so important that I'm going to repeat it. Rapid reporting is not your test to find any subtle, early, or suspicious finding. It is designed to test your ability to call something normal. Rapid reporting is like real life scenario. Some films are normal, others are abnormal. If you are going to give a weak report on every single image asking for clinical correlation, CT, and MRI, then you will have a big problem passing rapid reporting part of the exam. It is in fact designed to check if you can be a good and confident consultant and safely say, look, this is a normal film. Before jumping into image analysis, let me give you 3 golden rules of rapid reporting. If you follow these points, I can pretty much promise that you will pass this. Golden rule 1. Always zoom up. You will fail rapid reporting if you do not zoom up the image to look for the detail. Rule 2. Check your review areas. There will be several examples of review areas in this talk. Golden rule number 3, which is most important rule. Do not overcall. It means that each image is abnormal only if you are 100% sure of the abnormality. Being 100% means that you can make a $10,000 bet that this is abnormal. It may sound inappropriate, but I'm going to insist. If you cannot make a $10,000 bet on this fracture or abnormality, then it is not present. Everything is normal unless you are really sure that this is abnormal.
This video is presented in collaboration with Radicon Institute of Radiology. You are welcome to subscribe to our YouTube channel and click on the notification bell for updates. For more modules in Radiology CMEs, please visit our website www.radicon.org.